All right, everyone, welcome. Happy Tuesday for our newest webinar with Dr. Monica Boen. We are very excited to be here today to speak about a brand new topic that we haven't touched on at all yet really in our webinar series, and that is our research center, our research trials. What are we doing in research? What does it look like to be part of a study? How do you get free treatments? And everything else that goes into all of the research that is going on every single day at Cosmetic Laser Dermatology and West Dermatology. So thank you all for tuning in. I see a lot of you joining right now. As you get settled, I just want to point a couple things out to you. At the bottom of your screen, there should be a little button for Q&A. You are welcome to pop any questions that you might have there, and Dr. Boen can try and get to them at the end. And there's also a little chat feature if you need to chat with me privately or publicly at all. So, I hope everyone is here now. Once again, I am very excited to introduce board-certified dermatologist, Dr. Monica Boen. She is an associate at Cosmetic Laser Dermatology, and she is very involved in our research clinic, helping to direct and oversee many of the trials that we have going on. These trials lead to new products, new devices, and injectables getting FDA approval, new techniques being discovered, and then Dr. Boen and all of our dermatologists go off and teach other derms around the world. So I'm very excited, and I will hand this over to Dr. Monica Boen.
Hi guys, good afternoon, and thank you so much for joining our webinar series. Today we'll be talking about research, which I'm really passionate about. So I do medical and cosmetic dermatology, but I also really like to do research. I feel like it's great to be on the cusp of the newest devices and drug treatments in our field of cosmetic laser dermatology. And I think this gives me an extra fulfillment in my career to be able to be part of these research trials. And so today, I will give you a virtual tour of our research center. I'll tell you how to get involved in these research studies, and I'll give you a few examples of the research we do and that we present nationally and throughout the world. So today we'll start with and I just want to also add before we start that we see, as dermatologists, we see patients of all skin of color, and then we are with you and express sympathy for all people who are facing discrimination based on the color of their skin. Okay, now let's begin the tour. Hi, I'm Dr. Boen, and you know me from Cosmetic Laser Dermatology, where we do the latest and greatest in cosmetic dermatologic surgery. However, we also have a huge research wing. So today, I'm going to show you a little bit more about what we do on our research side. Take a look. So I walked just down the hall from our Cosmetic Laser Dermatology clinic office to our research center here. Come take a look. Hi. Hi. So what clinical trials can I enroll in today?
We have some studies for all therapy.
Okay.
That's for the jawline. We have.
Do you think I need a jawline? Do you think? We have a lot of fun on the research side.
It's nobody. I thought you were over there.
Oh man. Now we're in our research department. Leslie, come over here. So Leslie is one of our awesome research coordinators. So what are the coolest studies that you have going on? I mean, of course, they're my studies, but anyways, what other studies do you have?
We do have the laser hair removal for blonde or red hair. We have a basal cell study for basal cell carcinoma. We have study for crow's feet. We have a study for cellulite on the buttocks. We have studies on atopic dermatitis.
Cool. And now, very important question. I think we're gonna know the answer. Who is your favorite doctor?
Dr. Boen.
We won't tell anyone. Let's go take a look at the rooms and see what devices we have. So this is one of our research rooms. In here we did a microneedling, radio frequency microneedling study with one of the newest microneedling machines out there. This is one of our rooms. This is our other room. We have a study with biodynamic therapy, which treats skin cancers with this red light here. And then we're also having a study with the Fraxel Duel. I'm here with Alexis, one of our great research coordinators, and he's going to tell you a little bit more about how to get involved in research and the process.
Well, nice to meet you. I'm one of the research coordinators here. Best way to get involved with us is you have to show interest and you have to go to our webpage. We have plenty of research trials that are mainly involved for cosmetic results and for medical dermatology.
Awesome. What are some of the research studies that you're working on?
Pretty much what we have ongoing would be more related to like fillers, neuromodulators that are directed for wrinkles, skin sagginess, and we have a couple more that are for medical dermatology. One is for basal cell carcinoma, which is skin cancer, and another one that's for atopic dermatitis. All of these have to be diagnosed by one of our board-certified dermatologists here in our research department, and then we'll go on from there.
Gotcha. And the next important question, if you were stranded on an island, which doctor would you pick to be stranded with? And I will exclude myself because I know that I would be picked. Who would it be?
Well, actually the brain behind all of this, Dr. Mitchell Goldman.
Ah, smart answer, smart answer. All right, thanks. Thanks for educating us about that. So visit the website, and then that's the best way to get all the information. And we can also put you on the email list too.
Yeah, definitely.
To get you involved. All right, and now we're actually walking back to the cosmetic side. So as you can see, these two departments are very interchangeable. You can be part of a research study, but still continue to have other cosmetic treatments with us at Cosmetic Laser Dermatology. And many of the lasers are actually what we use in clinic now after we research them. Oh. Wow, this was like 20 years ago. Haven't aged a day. And that concludes our tour of the research department that is part of Cosmetic Laser Dermatology. Thanks for watching. Visit our website, sealderm.com. Click on research for more information. Okay, thanks for watching. So now a little bit more information about our website where you can find all of our latest research trials. It's at sealderm.com/research, or you can go to sealderm.com and click the research tab. And there's a list of currently enrolling studies if you scroll down. These are examples of some of the studies that are enrolling. And then you can click join the study at the bottom, which is the green button. And when you click that, you'll be prompted to fill out some more information, or you can give us a call as well to schedule an appointment so that we can go over some of the trials that are ongoing and then help you decide which one would be best for you. And luckily, many of these studies are free, so you're able to get these free laser treatments, free neuromodulator or filler treatments, or even be offered compensation. The caveat is that sometimes these appointments are longer than the appointments that we have in our cosmetic clinic, and usually you'll have to have more follow-up because they're part of a research study. But it's a great option if you're looking to get rid of some wrinkles, some brown spots, and these treatments are free and performed all by board-certified dermatologists. And here are some examples of our research studies. So you have an idea of what to do, and also we do these same treatments in clinic as well. So if you're wondering if you can have them in clinic, you definitely can also stop by there. So we'll start with the topical studies. So melasma is a really common skin condition that we treat daily in clinic. It's basically when you have these brown irregular patches on the cheeks, the forehead, and the upper lip. among other places. It's very distressing for patients and can be very hard to treat because it recurs due to sun exposure, hormones, and other factors. And a lot of our studies are investigating new topical compounds for this condition. So this is a previous study done by another clinic, but we're also testing a version of this SkinCeuticals product in our clinic for melasma and hyperpigmentation. And this uses tranexamic acid, which is one of the newest topical molecules to be used for melasma. And it's shown promising results in several studies. And now we're looking at a new formulation for it. So you're able to kind of get involved in these studies through our research department. And it's very exciting. It's kind of the newest and latest treatments for a lot of these cosmetic concerns. Other topical studies we do are for photo damage. So we investigated a new stem cell cream for rejuvenation of the face. This was a 12-week study where we investigated whether this cream would help fine lines or splotchiness of the skin. And we found that it was really, patients really liked this cream. It was easy to apply and help with fine lines. And it helped improve the texture and some of those blotchy appearance of the skin and was not irritating. And we published this study in one of our journals, the JDD, and we also presented this at one of our dermatology conferences as well. And next, we do a lot of filler and neuromodulator studies. And a lot of these studies are our own ideas that we wanted to test and prove in an evidence-based scientific manner. So about 2 years ago, Jawline Filler became really popular. And so I wanted to do a study to show about how to do this safely with a newer technique. And we used, in this case, calcium hydroxyapatite to restore the contour of the aging jawline. And we found that we decreased the wrinkles by using this technique, and it lasted even up to 90 days, which was the duration of our study. And for reference, the lower number is less wrinkles, so we wanted to decrease in this chart here, and had insane results. And this was presented in October in one of our ASDS meetings. And then here is an example. A patient had jowls, didn't really want to do anything invasive, so we added a filler to help smoothen that jawline and improve the jowls. And we do this in clinic as well. So we do a lot of leg vein treatments in their cosmetic side. And then about once a year, certain times of the year, we'll do a study with leg veins. And we've done a lot of study with leg veins. And basically, we're still trying to perfect our techniques and see if there's something better that can be done. So our preferred method for treating leg veins is sclerotherapy, where you inject sclerosant, or it's a type of detergent, into the veins. You inflame them, and then your body gets rid of the veins. It takes about 2 to 3 months to clear the veins. They get worse before they get better. So I always tell patients it's going to get red, it's not going to look good for a month, and they're going to start to clear. And sometimes you do need repeat treatment. So this patient had 2 treatments, and we got rid of some of these little red veins and some of the larger feeding veins as well. You can treat the smaller veins, and you can treat these varicose veins as well that are really common in the back of the legs, and they are treated nicely. And then even those really pesky larger veins can be treated beautifully with sclerotherapy. Usually this one does take 2 treatments to clear. We also do a lot of studies for lasers. So a lot of times there's a new laser device or an improved laser device on the market, and we're the first clinic to have this device and to test it in our research center. So Thermage FLX is the most advanced Thermage device used for skin tightening of the face and neck. It uses monopolar radio frequency to non-invasively improve skin laxity, and with minimal downtime. The best results are in 2 to 3 months because you're producing your own collagen. We presented this virtually because of the pandemic at ASLMS. This was accepted presentation. As you can see, all of the scores are decreased, which means there's less wrinkling in the upper face, lower face, the labial folds, and in the neck after 1 treatment using the newest Thermage FLX device. And this was well tolerated by patients. And this is frequent what we did in clinic. We use Thermage and Ulthera for skin tightening, but this is a way to do it through a research study using the latest device. We also, one of our most common treatments is the ablative laser resurfacing using a CO2 laser or an erbium laser. This is really good if you have a lot of photo damage, a lot of wrinkles, and we were investigating whether a topical stem cell cream could help improve the downtime, because the CO2 laser has amazing results. I love doing this treatment, but it has some downtime. And so we were investigating whether this cream helped with downtime, and there was a trend a little bit for this cream to help with recovery. And then on their left side here, we showed that wrinkles are much improved after using this CO2 treatment. As you can see, a lot of the browns are gone, the fine lines are improved, and this is just 30 days out. The best results are actually 3 months out, but as you can see, you're starting to see improvement. And this is another patient too, only 30 days out, so still maybe a little bit red, but you notice a lot of those deep lines are getting erased, fine lines are better, and the skin texture and overall skin quality after a CO2 laser resurfacing is much improved after this treatment. And then let's not forget about males. So the scalp of males is particularly concerning. So a lot of sun, sometimes not a lot of hair, and so we have a lot of browns there, and we're able to really get rid of these browns through an aggressive treatment using the Fraxel Duel, which is a 1927 non-ablative fractional thulium fiber laser, and this we published in Laser and Surgery Medicine, showing that this technique, using a specific technique with this laser, we're able to get rid of a lot of the photo damage of the male scalp and really improve this appearance of the scalp. And for males, this is, I think, really important. I've noticed that whenever we do this treatment, they feel more confident and are really happier after we erase some of this photo damage. So to summarize, we had a tour of our research facility, which is right next door to our Cosmetic Laser Dermatology clinic. We discussed how to get involved in the research studies through the website. And we gave examples of the research studies we do using lasers, fillers, neuromodulators, leg vein treatments, and laser treatments. And these are some of the same treatments you can find in clinic, but they will be free, either a reduced price or offer compensation. And here is more information. All right, so I guess we are gonna have time for a question and answer. And then at the end, we're gonna have a little giveaway.
Yes, hi everyone. Thank you for watching. If anyone has any questions, I encourage you to put them in the bottom where it says Q&A right now, and we can try and answer them as quickly as possible. Until then, let's see, I have a few to get us started. So, is getting a treatment that's part of a research study not as safe?
If it's a newer treatment, there's definitely some risks that we'll go over, but there's always that risk component of it, but we try to make it as safe as possible, and these studies have to go through an international review board, so they have to be approved studies in order for us to do them, and their safety has to be approved by an independent committee.
Got it. Okay. This one's from a Cynthia. So what is the length of time of a study?
For example, some of the cream studies are usually 12 weeks, and you can only do one study per at one time, and then you have to wait 30 days for another study. For the filler studies, they can be 90 days. And then at that time, it's important, you have to use the sunscreen and the products we provide, and others are longer, 6 months. So some of our cellulite studies are a little bit longer because it takes about 6 months to see the results after the cellulite studies.
Okay, this person says, is it possible to participate in a study if we already participated in another?
Yes, if you are done participating in one study, you can participate in another one 30 days later. There are some exclusion criteria. For example, if you had already a laser treatment on the face for a previous study, and then the other study is also a laser on the face, that might be an exclusion criteria for the other study. But you can usually do another part of the body.
Can we be screened for multiple studies? when we come in?
Yes, when you come in, you're going to be seen by one of our fellows, or I myself too see some of the patients, and these are board certified dermatologists, and they'll go over some of the studies you're interested in that you see on the website, and you can be screened for multiple studies, and you will be informed of maybe what you're the best candidate for.
Okay. Why is there an age cutoff for some of the studies, even though I'm healthy and my skin looks good?
A lot of the age cutoffs are given to us by the companies, unfortunately, so that's why they have age cutoffs for that.
Okay. Will you be doing any research studies on the neck anytime soon?
Yes, we do have a neck study actually that is ongoing. So please give us a call.
Okay.
I can't go over it online, but there's a really good neck study that is out.
Oh, is it already on our website?
It should be on our website this week, and it's for laser treatment of the neck.
Ooh, okay. So stay tuned. And if you're signed up for our email list or on social media, we will announce it as well whenever we add a new study. This is a great one from Terry. Would you be treated on the same day as the evaluation?
It depends. Some of the studies you cannot be treated on the same day due to the protocol or because it takes some setup. And some studies you can be treated on the same day. So it'll depend on the study.
Okay. Are face and neck jowl laser treatments as effective as surgery? That's not really about a research study, but that's okay.
It depends. Usually for jowls, of course, as surgery going on their knife is probably going to be the most tightening. But for others who don't want to undergo surgery, we do offer more minimally invasive treatments.
Got it. Okay. How do you choose people for a research study, and approximately how many people are part of each study at one time?
Usually, we have patients who come in for a screen that hear about it, and then they're signed up for the study. So a lot of times, patients are coming in asking for the study based on the email. They look at the website, and that's pretty much how that's the main way we kind of recruit. And what's the second half?
Approximately how many people are part of a study at any given time?
Right. Usually the studies are between 20 to 40 patients per study.
Let's see, what can disqualify a participant from a study?
If you're missing a lot of the study appointments, you may be disqualified just because of the protocol for that study. Or if you're excessively tan, or you cannot usually participate in a lot of the studies. But other than that, we really want to get people in the study, and we definitely are we're definitely trying our best to get you into a study.
You mentioned a cellulite study. What treatment is that?
That one, I can't go over the treatment options because it is an IRB study, but it is available and on our website. And you can give us a call too, and the coordinators will go over what the exact study drug is going on.
Sure, okay. Let's see. What does the follow-up look like? Is it a big commitment?
The follow-ups, sometimes you have a series of 3 laser treatments, and so those kind of happen at like each visit. So it's like 3 visits for the treatments, and then your follow-ups are sometimes a month, 2 months, and 3 months later, and those are mainly to see how you're doing, how you're tolerating the treatment, and doing photos. So those are a little bit less involved in the treatment.
Got it. And are any studies coming in soon regarding sagging skin to the arms?
Oh, we did do that treatment last year, but no studies coming in for the arms yet.
Okay. Has the sclerotherapy study started yet?
It is beginning to start, I think.
Okay.
So give us a call. Or we can click on the website too to be put on the list.
Okay, great. And I know some people are asking about sending in contact info and haven't heard back yet. We get a lot of inquiries for our research studies, and just coming out of COVID, we're still getting all of our staff back up to speed, but I assure you the research department is working hard to reply to everyone. And if you haven't heard back, you're welcome to send another inquiry, or you can even chat me here privately with your information and I can pass it along.
Yeah, absolutely. And then I'll double check too to make sure that we're on top of those emails, because I know we have like a lot of studies that are gearing up now, and we'd love to have you involved.
Absolutely. Okay, and then there's lots of questions coming in that are not related to research, but we really want to keep this about research today. So I encourage you guys to submit your questions on our contact form on our website, or to set up a one-on-one consultation with Dr. Boen, or tune in for one of our upcoming webinars where we're talking more about rejuvenation treatments. But anyways, we have a lot of people here, and are there any more questions, or would we like all to get to the big prize?
And thank you so much for joining our webinar and watching. And I'm really looking forward to seeing you guys on the research side and seeing if we can get you into some of our really cool studies.
Absolutely.
And now I think it's time for the giveaway.
Okay, I think so too.
Yeah.
Okay,
giveaway
so
time.
we have about 50 people here. So this is a little bit hard because we need someone who's local to come pick this up, and I know not all of you are. So I'm gonna pick randomly, and fingers crossed that I am picking someone local, okay? All right.
Okay.
Julie Mugni. Julie, are you here? Can you comment? Oh.
I'm here.
Yay, you are the winner.
Congrats.
Awesome.
Yay.
I am local.
Are you local?
I am.
Oh,
Perfect.
Yeah.
Yeah, so this is a great summer package. You have all your sunscreens, you got a good moisturizing cream. I love CeraVe. And then if you get brown spots, you can use Discoloration Defense to help get rid of them.
Oh, great. I'm so excited.
Perfect.
Yeah.
All right, Julie, we'll all private message you, and you can send me your info, and if it doesn't work for any reason, you can call. We have your name now.
Okay, great. Thank
so
you guys.
Congrats.
All right. So, well, thank you so much, Dr. Boen. I really appreciate your time. And
I hope this was helpful to everyone, and we really look forward to seeing you guys. And we're really excited to also be back in the office after a little bit of quarantine. And so very, very excited to be back.
Absolutely. And I see a couple more questions have come in. I'm going to stay on for 1 second to try and type in some answers so you guys know where to go to get them. But just real quickly, can out-of-state patients qualify for a research study?
Yeah, you can definitely qualify. And sometimes it's, as long as you're able to make the follow-up visits, we can do out-of-state patients.
Okay, great. Well, thank you all so much for tuning in. I hope you enjoyed learning about our research department. It's definitely a big part of our clinic and something that sets us apart from a lot of other clinics, and why we're able to bring you all some of the latest and greatest technology that's available. So please visit our website, which is right on the screen here, clderm.com/research. You can call or email or send us a message on social media, and we look forward to seeing you guys all soon.
Awesome. Thanks again for joining.
Thank you so much. Bye, everyone.